just so you know that ahead of time. But this is my first time lecturing, so be nice to me, but I'm usually behind the one-way glass in the sim lab, so that makes it a little bit easier. I don't get to interact face-to-face with you. So, but stop me anytime if you have questions or anything. I posted the PowerPoint yesterday. I've added a few things to my PowerPoint, so I'll post this PowerPoint after the class so y'all can have mine too. And then if you need anything, let me know. So this is just a little video that I wanted y'all to see. It kind of reminds me of me in school, and I know y'all in school. I completely identify with how you feel. So we'll just watch this for a second. So I know being a nursing student and being a graduate nursing student, we feel like sometimes we have the hang of things and then we get behind again, and then we have to catch back up again, and then we get behind again. So I think that's sometimes how we feel, both of us, you and I, in the process. Okay, so the concept today is coping. So we're going to look at the different parts of coping, what's related to coping, the concepts that are interrelated to it. I saw this and I thought this kind of fits the process as well as how you feel, especially halfway through the semester. These are our objectives, which y'all saw on the PowerPoint that I posted. We'll go through those as we go through the PowerPoint. So anxiety versus stress. I know that you all know firsthand what that feels like. You're getting into, I think, test 3, so I know there's a little bit of stress and anxiety with that. Just so you know, anxiety is an emotional response. Stress comes from what is around you that's causing you to be stressed. So on the anxiety spectrum, anxiety can result in many different forms. It can be mild anxiety all the way down to panic anxiety. And it can fluctuate. It's a fluid movement on that scale. So an example that I have personally was when I went to go take my NCLEX. I remember sitting there scared to death in the parking lot. Walked in, they make you wear like jeans, a white t-shirt, and like no shoes when you go in there. And so you kind of feel like you're in prison a little bit. So I walked in, and the first thing she says is, sit down, here's earplugs. I'm going to be watching you on this camera that's literally 6 inches from your head. And take your test. When you get done, you can get up. The screen will just shut off. So anxiety has shifted from here all the way into here somewhere. And so then we go through, I start taking the test. It's me and one other girl in the room. All I can hear her doing is tapping on the keyboard the whole time. She's typing something, she's doing a writing test. And so all I can hear is backspace, backspace, backspace. And I'm like, oh. So I think, oh, I've got earplugs, so I'll put the earplugs in. Well, I'll put the earplugs in, I can still hear. I put the earplugs in a little bit further, I can still hear. A little bit further, I can still hear. Finally, I realized that I cannot get the earplugs out. So, in the middle of the event, I'm like this, shaking my head, pulling on my ear. I'm like this lady in the camera thinks I've lost my mind. So we went on down into here, and then all of a sudden the computer shuts off. But it doesn't shut off at 75 questions like everybody else. It shuts off at 88. And I'm like, well, great. They gave me 13 more. I didn't know very good, you know. So just so you know, the anxiety spectrum can fluctuate. Then when you get your NCLEX results, it comes way back up here because you passed, right? So that's my anxiety spectrum example. So what does anxiety feel like? It's going to be someone that's got the heart racing, they can't feel, they're shaking. A lot of like what I felt this morning before I started talking to you. So I remember telling a friend last night, I'm lecturing for the first time tomorrow. And she goes, that's great, what's the topic? And I said, stress and anxiety. And she's like, you should have that covered, Vince. So what do you do to decrease anxiety? There's a lot of things that you can do to decrease anxiety. One is a lot of people will meditate. This is where your coping strategies come in. Do you cope positively or do you cope negatively, right? So positively would be meditating if you're religious, focusing on scriptures or anything like that. Listening to music, just something to take your mind off of what is making you anxious. Negative coping would be drugs, alcohol, different things like that. So one research study that I read showed that anxiety and stress decrease if you blow bubbles. So it showed that because you have to focus so much air into your mouth to get air through the little bubble one, that it actually decreases your stress and anxiety. So I brought y'all some bubbles today. So as testing comes, when you get stressed, you can blow bubbles, and hopefully it'll help make you feel a little bit better. These are your anxiety disorders. We'll go through those a little bit more. Generalized anxiety disorder is probably one of the most common disorders that you'll see. You must have 4 of the following to qualify for a diagnosis of generalized anxiety disorder. And that's kind of what you look like with generalized anxiety disorder. That shaking, the rapid heartbeat, the feeling faint, wobbly legs. And because of that, depression is common. Panic disorder is also a disorder, and most of you know on that spectrum, panic was at the very end, so that's one of your high anxiety states. So someone that comes in to the ER is going to be totally detached from reality. They're not going to be able to function, to know what you're saying. They're not going to hear what you're saying. So communication is going to be hard at that point until you get them de-escalate a little bit. And here are the criteria for panic disorders, which you'll have in your PowerPoint. Phobia. Phobias result from repressed conflicts. And I found an interesting example that I want to share with y'all about phobias. It kind of brought to light. I can remember watching Fear Factor growing up and seeing those people do all those horrible things with those horrible bugs and things like that. But this example said a young woman had a phobia of spiders. When she was a little girl, her father became ill and died. Through months of therapy, it was discovered that the explanation provided to her was Daddy got a bug. That's what they told her when he died when she was little. She equated spiders to death. So that's why she has a phobia, was because of his death was related to bugs. So kind of like they do in Fear Factor, they do systematic desensitization, and that is where you slowly introduce someone to the fear, little by little, to get them adjusted to it and hopefully overcome their fear. Obsessive compulsive disorder. I think as nurses, we all have a little bit of obsessive compulsive disorder, but they obsess over something and then it becomes a compulsion. They have to do so many things. So they're obsessed over germs, so they wash their hands 55 times. Now, like I said, we all as nurses have a little bit of it. Not all OCD behavior is negative, because we do want to be a little OCD when we're giving medications, or like this has a bank teller counting money back to you. So you want to count it a bunch of times to make sure you've got the right medication for that patient, that kind of thing. Okay, so here's just like a little patient example. A 44-year-old woman is seen in the clinic with complaints of insomnia, feeling of dread, irritability, and uneasiness. She relates that this has been going on for about 2 years, but is now interfering with work and she can't concentrate. She is tense and ready to snap. So what do you think is going on with her?
Anxiety disorder.
Generalized anxiety disorder. That's right. Okay. A 33-year-old mother of two is sitting at the Red Cross shelter. A tornado has just destroyed her town and killed her husband. Her children are sitting next to her, and although they are crying, the patient is unaware. She is unable to express herself and clearly mumbles about unimportant details. What's going on with her? She is stressed out, but this would be a form of panic where they disassociate themselves from reality. So she's not even thinking about what's going on and has lost touch. Okay, last one. An 18-year-old woman presents to the campus clinic and relates a history of child abuse, including imprisonment in a dark basement. The night before, she attempted to settle in for the night in her new dorm room with a roommate. The roommate attempted to turn the light off, but the patient became agitated, saying that she can't sleep with the lights off. The patient understands where her fear comes from, but is unable to manage into sleeping in a dark room.
Phobia.
So, because of a traumatic event, she's now developed a fear for the dark. So, eating disorders is also part of your related to anxiety and coping. Okay. Obviously, you're not coping well with body image, different things that may have happened in your life that have caused you to concentrate on your weight and focus on that. So this is just an example of what she sees and what we see on her, but what she sees in her head. So it's a different image. And there's a bunch of, obviously because they're so thin, they can be malnourished, may not have periods, which is the amenorrhea, different things like that. They have electrolyte imbalances because of it, so that's important from the nursing perspective when they come in and they're 80 pounds or whatever. Recovery for anorexia. It's got to be a slow process. You don't want that. You don't want to just feed, weight gain. You want to slowly add on the weight. So it's important to monitor for all the body systems because they're all going to be affected because of the anorexia. Bulimia. They do the binge eating. So they'll eat, and then they may throw up. It's a little bit more hidden than anorexia. Harder for us to see sometimes with it without actually seeing them vomit. So you'll hear the word binge and purge. And these can be just bingers, so that's also an overweight example. Somebody that's overweight, they just binge, they don't purge. Separation anxiety. If you have children, you've probably dealt with separation anxiety at some point. It's normal between the ages of 12 to 15 months. And that's when they don't want mom or dad to leave, or they have trouble functioning with like going to school, that kind of thing. Okay, so stress. Y'all are all stressed, I know. But there's different forms of stress, stress-related illnesses. So there's spectrums on the stress as well. You can be just stressed, or you can be overwhelmingly stressed, where it turns into diseases and ulcers and different things like that, right? And then there's post-traumatic stress. So this is kind of showing how you can reduce some of the stress in your life, medication, different things like that, relaxation, proper nutrition, exercise. So post-traumatic stress, I know that's in the news a lot, so we hear a lot about post-traumatic stress disorder, especially with our military folks. This can be from war, natural disasters, or personal violence. And personal violence could be like a rape or something like that. So anything like that that they have to relive over and over in their head, it can go anywhere from nightmares to full psychosis. So it's important to know that substance abuse can be common with these people because they don't know how to cope otherwise with the disease. So it's important to identify that early so that you can get them treatment and help that they need. Peptic ulcer disease goes through the 3 stages right there. Alarm, resistance, exhaustion. I think you'll have all that in your PowerPoint, so I'll let y'all look at that. Okay, one thing I want you to do is Ms. Rutherford's going to pass out a life stress questionnaire. This is just a fun questionnaire to kind of judge how stressed you are in your life. So you're going to give I think there's enough for y'all to share, but you'll just write down your score at the end, and then we'll go over what the score means. So within the last year, what have you experienced on this list? And you'll tally your points up. Okay? So I'll give you all a few minutes to do that. Okay, so let's look at the results. Okay, so here's the results of what. Okay, so your score, wherever it falls in this range, that's how you interpret the results. Does that kind of give you an aspect of your stress? maybe if we need to learn some of the coping behaviors. Any questions so far on anything?
I want to know who got normal.
Okay, yeah, if you're normal, raise your hand. We want to know who you are. You're coping very well. Oh, y'all did good. I'm impressed.
That's all the A students.
And if you scored above 350, make an appointment with Dr. Henderson. Okay. So anxiety assessment, like in the nursing process, would be through this. What you're going to assess that patient, their behaviors, their mood, their communication and speech, different things like that. You're going to watch for it. Because remember, the spectrum of anxiety is really big, so you want to know where they fall on that. Are they appropriate with their speech? Are they disassociated with you completely and you're not getting through to them? There's some diagnoses related to anxiety. Some goals. Obviously, we want the patient to return to a normal function of life. We want to decrease their anxiety. So these are some goals that would help you reach that with the patient. Planning, we want the patient to understand what are the triggers, what causes their anxiety, ways that they feel that decrease their anxiety, help develop something, some kind of technique with them so that when they do feel the urge for anxiety to come on, that they know how to handle it. And these are all in your PowerPoint. Interventions. Probably once you get them down, de-escalate a little bit from those panic states. Your patient education, educating family members that are with them, that kind of thing are going to be important. Medication may be needed for some of the patients, and so educating the patient on those medications, the importance of staying on those medications, following the physician's orders, different things like that. So these are some of the categories of medications that an anxiety person may be on. Benzodiazepines are what you probably see a lot. The Ativan, different things like that. SSRIs are and SNRIs are both antidepressants, and so you'll see those. An SSRI, let's see, I wrote down some examples that y'all may have seen in the like in the media or whatever. So your SSRIs are going to be your Zoloft, your Paxil, different things like that. SNRIs are Cymbalta, Effexor, and then Buspar is the name of the medication. You may also see some on propranolol, which is a beta blocker. A lot of people with test anxiety will take that sometimes just to help decrease some of their anxiety-related tests. Evaluation, you're going to look at your plan. Did it work? If not, we're going to go back and refigure out a plan for that patient. Okay, so now we're going to switch to negative coping strategies. So substance abuse and addictive behaviors. There's the ones that we're going to look at are alcoholism, maternal fetal cocaine addiction, and neonatal abstinence syndrome and withdrawal symptoms. So these are your disorders that are associated with those. And y'all have these on your PowerPoint. Alcoholism, the effects of the alcoholism. Wernicke's encephalopathy, in case you didn't know what that was, that's the lesions in the brain that are caused by alcoholism. Obviously, cardiomyopathy, that's dealing with the heart, right? And cirrhosis is the liver, things like that. Legal intoxication, y'all know what that is. That's the legal women who can be intoxicated. Maternal fetal cocaine addiction. You'll sometimes hear them referred to as crack babies. A lot of times this is difficult to see because they're little babies, and they're usually, depending on how much drug they got and when in the gestational stage they got the drug, will determine what their clinical manifestations are with the addiction. Treatment may require morphine or methadone, which is a you'll hear a lot about methadone clinics that help people get off of the drugs, and so sometimes the babies are also treated with that. This is what the infant will present with, and it's really sad if you ever see that happen, because they're little bitty and just having a whole lot of trouble in their first few years. I have a video, sorry, I know it's not very encouraging, but just to kind of show you what that looks like.
I think a lot of the nurses in here feel terrible for the babies, how they withdraw. What we see is we see trembling of their extremities. Sometimes we'll even see seizure activities. They're very jittery. Their muscles are very, very tight. And these babies, they constantly have to have a pacifier in their mouth. They have to be swaddled. They have to have a nurse with them, holding them, rocking them. They have a hard time settling themselves. Like a healthy newborn can, after they eat, they can sleep for 2 to 3 hours. The babies that are withdrawing, you can feed them and you'll put them down, or sometimes you can't even put them down, but they'll only sleep for 15, 20, 30 minutes, and they're up again, wanting to eat again, or they're continually crying. It's heartbreaking. It's sad to see them go through cramping of the stomach and screaming all the time and vomiting for a newborn.
I didn't plan on getting pregnant, so I didn't realize that I was at first, and continued with the same lifestyle that I had always been living. I was used to going out with my friends, having fun, partying, and my friends, you know, they weren't pregnant, they kept going out, having a good time. They told me that it wasn't a big deal, that I didn't have to worry about it. And honestly, I felt cheated if I couldn't have that drink, or if I couldn't have that cigarette. I felt cheated. Like, you know, why is this burden been placed upon me? Looking back, I am so full of regret for my actions, what I did. I just wish I could go back and make things right.
What is important for a pregnant mother to realize is that anything that she breathes in or drinks or ingests will ultimately affect that unborn child. Many babies that we see that are born to moms who have used a combination of drugs become addicted to just not one specific drug per se. A lot of babies have been exposed during the length of the pregnancy to many substances such as alcohol, tobacco, caffeine, prescription pain medications that might be needed, and also a variety of illegal drugs such as marijuana and cocaine and heroin.
One of the biggest obstacles for parents, if they have had an addiction history, is they have to work through a Child Protective Service agency. It's an automatic referral for a child in need of protection and services, and so they'll have to sometimes, you know, agree to services, and that, I think that can be very stressful for them. That can be very, very challenging. We work with the families to help make sure that they're coping with what's going on with their baby, and to make the appropriate referral services to support them for things that are occurring. Some people have limited resources, so we try and link them to appropriate community resources that are going to help them meet the needs of their babies.
In terms of the long-term developmental consequences, we're still in the infancy period, so to speak, in terms of quantifying and qualifying problems that these infants will have. Some babies have effects to their eyes. Other babies continue to have, increased muscle tone, and they require intensive and aggressive physical therapy. Many of these substances were used during that first critical trimester, so the effects on brain growth and development sometimes aren't known until the child is school age. but there is a high incidence of attention deficit and hyperactivity disorder. And other behavior problems.
Early On program is the only program in the area that is not based on income. We base it on a child. We look at the child. We look at every area of the child's development. And if they qualify with a developmental delay, that's one way they can get services through our program. Another way is with an established condition. And one of the established conditions we have is toxic drug exposure. A lot of these little ones have issues with home, which they tend to be kind of tight. So we do have physical therapy services that can go into the home and work with them on just functionally, how do we get these babies to loosen up. We have speech therapy, we have social work, physical therapy, occupational therapy services, and they can all go in the home and work with these infants.
In addition to my own struggles, staying clean, kicking the habits, I have the added stress of a high needs child. And it's been really difficult and it's a continuous struggle. I'm so thankful for my physician and all the help that he provided me, the education and the support. And I'm especially thankful for the programs that were available for my child that really helped him in his early development stages. He's doing better every day. We continue to see improvements, and this program has just been wonderful, and it gives us hope for the future.
Probably the most crucial point for mothers to avoid any illegal or illegal substances that are known to affect the unborn child is during the first trimester. Of course, this is a period where most moms don't realize that they're pregnant. So they are still continuing to smoke and drink alcohol and take prescribed medications or using illegal substances that they may be using. The sooner they realize that they're having problems, that they do have a substance abuse problem or are misusing drugs, the sooner that they get help, the better off they will be and the better off their unborn baby will be as well.
Help is available. Call 211 or your local physician today.
Okay, so I thought that video was really good to kind of show you how a baby reacts in the nurse's perspective on what they see, because if you are a NICU nurse or a nurse in any part of the hospital, you can see something like that at times, whether it's a neonate or it's an adult that's addicted to something. I also thought the video was neat that that program is not income-based, that they base it on the need for the child. A lot of times there's a stigma attached to drug use and drug addiction, that it's low-income people, and it's not always that case. So I think that was a good point to make, that it can be anybody in any walk of life. So these are different nursing diagnoses for substance abuse that you might see when you're admitting a patient to the hospital. It's important with any of these coping disorders to know what the patient has been taking, right? Because you don't want to give somebody something if they're already on something that's going to intensify the effect of that medication, correct? So if we were to give them if they've been taking medications that depress their CNS, we don't want to give them something else that's going to depress their CNS, right? Or stimulate their CNS, and we're going to get, you see what I'm saying? So it's important on that assessment of your patient, whether it's the first assessment that just came in, to know what they've been taking, both legal and illegal, you'll see that question a lot, and sometimes you feel bad asking it. It's kind of like, how many times do you drink? How much do you drink? Do you smoke? How much do you smoke? Do you use illegal drugs? But it's important because as healthcare professionals, the judgment's not there, but we need to know for treatment purposes what's going on with you. Outcome identification, so this would be like your goals. What are we trying to do for this patient? We want to get them out of the habit or the behavior that they're in that's causing them substance abuse. We want to find out what is the underlying cause of that substance abuse. What in their life is causing them to turn to a negative coping mechanism, if that makes sense. Good eating habits, good exercise habits, getting them in a program that could help them benefit and bring wellness to their life rather than that. Just listening to them, and also family issues can be a big thing with patients. That's usually one of the main reasons that they cope negatively. Something's happened family-wise. So just getting them to resolve any of these conflicts without the use of substance. Here's some interventions. It involves the client and the family because it affects everybody. We want to give them a safe environment and find out what they need to become healthy. Medication management, like I mentioned, morphine or methadone is also something that they can be on to help get them off, like cocaine and things like that. They also need to know the effects, and we as nurses need to watch for the effects that these illegal drugs can have on their system. So there's heart problems that can occur from cocaine and different things like that. So we want to look for the different medical conditions that can occur from that as well. There's just some more drugs that they can use to get off of the substance that they're using. Pain management, some people are using drugs because they have a lot of pain, maybe from an injury or something. So getting them with a specialist to help them treat that pain may help them get off of the substance that they're on. There's group therapy, family therapy. There's the 12-step program through the Alcoholics Anonymous. There's also Narcotics Anonymous, different things like that. There's also Al-Anon, which is a Narcotics Anonymous for the family members that are going through it, that have a person that's suffering from substance abuse, and they're on the other end of it, and it's support for them as well.
What did you say the last one was?
Al-Anon.
Al-Anon?
Mm-hmm. And then evaluation. Obviously, our goal is to be completely free from drugs and abuse. There's all kinds of programs, inpatient to rehabs to halfway houses, day programs, different things like that. Okay, so now I'm going to give each of you a part of the nursing process. And I want you to make a poster. I'm just kind of divide you up into 4 sections. Each of you to make a poster on generalized anxiety disorder. So we're going to go back, and I'll put back up there some generalized anxiety disorder stuff. But I just want you to does everybody remember the nursing process, right? Yes, maybe you might remember that from first semester. So this group over here, I'm going to give y'all assessment. So y'all are going to do assessment of generalized anxiety disorder. And then y'all, I'm going to give, let's do diagnosis for y'all. So find a diagnosis that you would use for, or several diagnoses that you would use for generalized anxiety disorder. This group right here, you'll do goals and planning. So what do you want it to be? And then y'all from here over, we'll do implementation evaluation. Okay. And I'll give you a poster boards and markers.
Yeah, no, right, come over, straight.
Smoking relieves stress.
About 10 minutes.
No, we don't have to do like the actual, oh, okay, I got you. No. All right. We're just gonna
Like, yeah, you're not making this.
You should take that out.
Of different ones that you have to choose.
Don't worry, we got it off the printed list.
Grandpa must come to that turkey.
like you got most of your things together in your life, and then you're just like going along, and then after 35, your body's just like. I get people's ages wrong, or like I took your dog used to. I didn't think you were 26. I mean, it's not old, but I still think you were 25. Oh, sorry.
That's an emergent there.
That would have been bad. I didn't even think about
I just wouldn't even guess it. I wouldn't even guess 30s to be honest. I wouldn't get, oh, well, no, you wouldn't be in your 40s. You'd probably be like close to, I would say closer to 30.
I'm like baby.
I'd probably guess 30, which is I think closer to 30. You don't have any accidents on the face. Definitely younger. Acting. Yeah. No, yeah, dude, I thought it was 22 all the time.
I don't know about Justin. I think Justin actually.
Mr. Franklin, aren't you 28?
What now?
28, aren't you 28?
Well, I'm 29.
You're lying, dude. Like, he's like, he's at least 35. How are you again? Like, they still,
I just turned 40 2
I
weeks
can
ago.
tell they're 40, but even though they don't look 40, you know what I mean?
Yeah, I turned 40 2 weeks ago. Sorry for interrupting.
We're talking about how bad we are against people's ages.
They've not been doing good so far. It's been rough.
Because like,
What
you
do you
don't
think
look
about me?
40, but I can assume that you're 40 just because you like, you seem older. You know, like personality doesn't necessarily mean like the way you look. I could guess
If
that.
y'all are still finishing up down there, that's fine. I'm gonna let assessment go ahead and present so that they can, they're finished. So we'll kind of go down the road that way. So try to finish up in the next few minutes. And if y'all want to present, and if y'all ready.
Yeah, what's up? I'll sign it for you. Oh, you forgot the sheet there. Okay. Just send me an email, just to make sure.
It'll kind of help you if you're down here working on skill set. Okay, so assessment, there's two sides. The first one is the history. So, we put muscle aches and spasms, headaches, inability to relax, apprehension, fear, anger, difficulty concentrating, eating and sleeping, memory loss, insomnia, fatigue, difficulty swallowing, irritability, frequent urination, hot flashes, lightheadedness.
Okay, so for the assessment on the physical findings, what you'll see is you'll see trembling, twitching, short of breath, tachycardia, tachypnea, your blood pressure is going to be elevated, and sweating.
Okay, next group, y'all ready? Listen up, y'all. Okay, so we have the diagnosis part of it, and a big list of things, anxieties, chronic low self-esteem, deficient knowledge, medication limits, fatigue, hopelessness, impaired social interaction, risk for suicide, self-neglect, stress overload.
Intrepid family processes, fear, ineffective role performance, social isolation, disturbed sleep patterns, activity intolerance, impaired home maintenance, decisional comfort, and ineffectiveness.
All right.
Good job. Huh?
Thanks.
Okay, we have planning and goals. Basically, whenever you're planning, you have patient planning as well as your nursing goals. For the patient, we want for them to learn about anxiety and generalized anxiety disorder. Just what is it exactly that they have? You want for them to be able to identify and recognize what their worry is. Where is this coming from? What's the underlying cause? That way we can try to treat that. Classifying your different types of worries as well as management goals for those kind of worries, such as slowing down your breathing, tensing, relaxing your muscles, and you need to learn to become comfortable with uncertainty. I think that's kind of a big one. As far as nursing goals and planning, you want to do patient teaching, and you want to be able to put them into a quiet, relaxing, low stimulus environment, medication therapies as needed, and you need to be able to help plan and set realistic goals with your patient, because you want them to have no anxiety by tomorrow. It's just not going to happen. That's it.
Dangerous. We talked about that last week.
I'm careful. We talked about that last week.
Develop effective coping mechanisms, perform personal or home care effectively, or maintain family and friend relationships. Maintain autonomy and independence. So that's how you would evaluate those.
All right.
any questions on anything? I'll post my PowerPoint later that was up here so that y'all can have all of that too, in addition to the one I posted yesterday. If you have any questions, let me know. I appreciate y'all being such a good audience for me today and for helping me with this part. Y'all made it really easy, so I appreciate that. Thank y'all.
Thank you.
Y'all want a break?
So before you take a break, say you're gonna come back, but you might not come back. So come back at 10 after 10, okay?
No, I'm at 340, so.
You haven't signed in.
Well, when you move and you have a kid at the same time, and your husband's on, and then he breaks his ankle.
Mrs.
You're in driving school.
Huh? I know, I tell you.
I like your jacket. It's really cute. It's from the